I am Lee Aase, the founder of HELPcare, and we are bringing the free market healthcare revolution to Minnesota. I started as the manager of the media relations team at Mayo Clinic, and I got Mayo Clinic engaged in social media on Facebook, Twitter, YouTube, those platforms. And that resulted in me being featured in Minnesota Monthly Magazine as in the Revolutionaries. I was one of 12 Minnesotans who are changing the way we think about the world and its future. Of course, it wasn't just me. We had a team, and Ron here was part of that team. I was the visionary guy. He was the guy that made all the trains run on time. He was the guy that took care of all the details and really was a great partner in making this happen, so I'm really glad he's able to be with us this morning. We put together a little book called Bringing the Social Media Revolution to Healthcare. It's still available on Amazon if you'd like to buy it. I don't know who gets the money, but I also was featured in Health Leaders magazine and their Health Leaders 20. These are our annual profile of 20 individuals making a difference in healthcare. And then in 2013, I was in the third class of innovative individuals named to the Healthcare Internet Hall of Fame. It's not like it's Cooperstown or Canton or anything like that, but it's in my little part of the world, it was a pretty cool thing. So that was me. I was blessed to be able to help take the healthcare social media revolution to 5 continents, 12 countries, 45 states. Got to go to Australia 3 times, on which one of them I got to make a stopover at Hobbiton. Spent a couple weeks in China, a week in Russia, 48 hours in Kenya. So it was kind of, it was just an amazing thing, and I'm really grateful for that experience. This is 5 years ago, last month, I was spending several very hot days in Dubai, where we were planning our Middle East Healthcare Social Media Conference in Dubai. This was part of that planning trip. And then 5 years ago this month, I had a fateful coffee with Dr. Dave Strobel, who's a classmate of mine, Austin High School class of 1981. Austin High School is the Packers. We are the good Packers. The Packers who are in red and white and not green and gold like the losers from out east. And Dave was telling me about this clinic where he was working. It was owned by the Pipe Trades Union, where he was employed. And he told me how cool it was, and I said, wouldn't it be cool if we had something like that in Austin, in our hometown, where you didn't have to be just a member of a particular union, but anyone could buy a membership. And so I resolved at that time that I was going to go back and get my MBA in healthcare management, and that's what I did. So, but meanwhile, 5 years from December, we held that Healthcare Social Media Summit in Dubai. I went back for that. And I also got my first ride on a camel, which will also be my last ride on a camel. This was when Dave and I were together in April of 2021, and I had just gotten notification that I'd passed my last requirement for my MBA in healthcare management. And we made plans for me to leave, which I did in August of 2021 to help start HELPcare Clinic. This was us on our first day in February of 2022. This was all the team that we had. Our only employee was, this was Dave and his wife Lorene with Lisa and me, and then our one employee who was Colleen Olmstead. Since then, we've added 2 more nurse practitioners. Well, 1 nurse practitioner, 1 PA. So Stephanie Kimmis on the right is our nurse practitioner. Elizabeth Hedlund on the left is our physician assistant. This is our office staff minus Lisa. So Colleen, as our operations director, now has 2 other part-time receptionists. The one on the right is Sandy Rowe, and Sandy, when she joined as one of our founding members of HELPcare Clinic in 2022, said, you know, I have a daughter who's a nurse practitioner who lives in California. And we were proud to announce yesterday that her daughter, Danae, has become our 4th provider, our 4th practitioner, and so she's here to help us with the surge of new members that are coming. Margot White, who's our clinical director on the right, now has a team of 7 nurses, and one medical assistant and one full-time phlebotomist. We're delighted to have this team working with us as well. And then this is our leadership team for HELPcare. So the two non-Aase members of the HELPcare leadership team are Colleen and Margot, but my daughter Rachel in the middle is our integrator. I'm the visionary, and my son Joe on the right is our part-time marketing director. Our legal structure is a little different in that we are set up as two separate organizations. HELPcare LLC is the organization that Lisa and I are the majority investors in. We take care of all the day-to-day details so that Dr. Dave and the practitioners who own the medical practice can take care of the patients and not have to worry about those all those things. So that's the structure we have. We have a management services organization. These are our HELPcare core values, and just in the interest of time, I'm going to focus on the top one, which is ownership. We think it's really important to have ownership. And so all of our staff we want to have that are part of the HELPcare side of things, we want to have be part, not just have feeling of ownership, but actual real ownership, that they have some equity in this, they have an opportunity to prosper together as we're growing and serving more people. So these are the two organizations. HELPcare is the management organization for HELPcare Clinic, and we are owners, helping owners serve our members. And our passion is to build relationships with our members to help them take charge of their health and their healthcare. So if you think about it, we're actually trying to have them have ownership in their health too, because it's not about what they do in the doctor's office, it's about what they do day to day, and we provide guidance with that. So at HELPcare Clinic, we're providing the thing that the healthcare system is missing, which is unhurried personal care. And through our membership program, you get timely care for your acute needs, same day, next day kind of service, more than 100 lab tests as needed, and then health coaching to help people take charge of their health to reverse and prevent disease. Those are all included. Since we started, we're up to now 980 active members as of today. And when Dr. Dave and I got together, I sort of thought I was thinking up the idea of what we were doing. Turns out that there was this concept that I didn't know about called direct primary care. We're now in Austin and Rochester, but this is the concept, this is the revolutionary concept, one revolutionary concept, direct primary care. About 250,000 people across the country now are getting care in this way through a membership approach where you don't pay for the office visits, you don't pay for the lab tests, you get it all as part of a package, and it's kind of like a gym membership only for healthcare. Nobody seriously disputes that healthcare is too expensive. What a lot of people in our part of the state don't realize is just how much more expensive it is here than elsewhere. So Lisa and I were looking for an exchange plan, what it would cost to get the cheapest Medica plan that we could find, the cheapest plan on the exchange. It turns out it was a Medica plan with a $7,500 per person deductible. If you were to get that plan, that policy in the Twin Cities without the tax credits, in Hastings in the South Metro, Coon Rapids in the North Metro, it's $1,186 a month. That's before the tax credits. That same policy in Austin, Albert Lea, and Rochester is over $2,000 a month. That's what I call the Southeastern Minnesota surcharge. Anybody have any idea what they have in the Twin Cities that we don't have here? Options, yeah, competition, okay, a market, and so that's kind of what we're trying to do here is to create options, to create a market, to create choices. And so it's just like when Ray and Kevin are talking about the increases in property casualty rates. They say, hey, there's a lot of hailstorms, there's a lot of damage, there's a lot of claims. Well, that's kind of the same way with healthcare. You're never going to spend less on health insurance until you start spending less on health care. And so what we're trying to do is provide an option for people to be able to do just that. That's why I was excited to learn about the free market healthcare revolution. And I was able to attend the Free Market Medical Association meeting in Oklahoma City earlier this year. Got to meet some folks, became a co-leader. of the Minnesota chapter of the Free Market Medical Association. The folks that I'm pictured next to my co-chair, as well as the chairs for Iowa and Wisconsin. The guy there with the light behind him that looks like a halo isn't really an angel. He's Matt Ort. He's the author of this book that you guys have in front of you. And glad to be joining with them. I was able to take Ruthie and her sister on a trip to Boston, and we went to Griffin's Wharf where the Boston Tea Party happened. And what a lot of people don't realize is that this tax that they revolted over was 3 cents per pound on tea. That's way less than a 70% upcharge on your health care. So a revolution is really needed. It's clearly needed. The good thing is we don't have to do vandalism or violence or anything like that. We just need to use the marketplace, okay? So Medgarden Southwest Sales, Spencer Medgarden was one of the first people to take advantage of the plan that we have, where we include our HELPcare Clinic membership within an employee health plan. He saved 22% on his renewal compared to Blue Cross Blue Shield, and got better care for the employees because they get our membership and they get all the free care that's included with it. So coming soon, next week we're going to be announcing a new deal with an employer with 650 lives between employees and their dependents. So that's why we need Danae and probably some other new practitioners to help us. And we have several other smaller to medium-sized businesses that are interested in doing this as well, proposals pending. And in every case, they'll save money and they'll get better care for their employees. So at HELPcare, our side of things, our passion is the same as for HELPcare Clinic, but with the added part is that we want to help practitioners be able to escape the matrix. We want to be able to have them be able to own their own practices where they can practice medicine in the way they want to, the way they feel called to do, and to restore those relationships. So our passion is building relationships to help people take charge of their health care, and their healthcare career. And so what I'm asking for you today in referrals is 3 types of revolutionary referrals. First, individuals who are interested in this kind of care, who would resonate with unhurried appointments with their practitioners. With business owners who are tired of the spiraling cost of insurance and health care for their employees and looking to make a change. And then finally for practitioners who are tired of the treadmill, the 15-minute office visit where they can't really do primary care. And so I am Lee Aase, and I am the founder of HELPcare. I'm inviting you to join me in bringing the free market healthcare revolution to Minnesota. Thanks.